Hi, guys. I wanted to talk to you regarding the week 5 discussion that we had with our client Tracy and evaluating her and setting her up with a program. So, first off, one of the questions was, what risk factors does Tracy have? I think only one person in the class got these correct. We're talking about ACSM risk factors, right? Your textbooks are ACSM. ACSM is the gold standard. So Tracy's real risk factors were only two, that she's sedentary because she's only exercising 1 time a week. So she's not meeting the minimum requirements for exercise. And then also her body fat percentage was, I think it was 28, putting her in the poor rating for body fat percentage, which ACSM says you can use percentage body fat or BMI, right? So that's directly in your textbook on page 309. Okay. So making sure, again, we are using the textbooks. It was pretty clear. I think probably 11 of the 14 of you had the exact same format, the exact same exercise recommendations, and the exact same risk factors, that you're probably putting a lot of this into AI. AI is not going to help you when you are sitting face to face with the client and want to make an impact on their life, right? They don't need you as a trainer if you're going to put their program into AI and they can just do that themselves. Okay. What we're learning here cannot be done by AI. Okay. So please do not use AI for your assignments. Again, whether it is helping you get a good grade right now, it is not helping you in the future. Okay. So again, just two ACSM risk factors. Okay. So those were the two that you should have said that were ACSM risk factors. Talking about her arthritis in her knees and how she has some issues with her knee swelling um, is important to note. It's also important to note that she does have some family history of some chronic health issues. They weren't cardiovascular health issues, therefore they were not ACSM risk factors. So noting those, that's fine. And then what else did she have? She had, oh, and her asthma. Again, it was only intensified by high intensity exercise. Tracy is obese and a non-exerciser currently, or she's not exercising enough, right? 1 day a week is not meeting the minimum requirements. So she's sedentary. You're not going to have an obese, sedentary woman, any person, woman, man, anyone, start out with an exercise program that is anywhere near high intensity. So for those of you who wrote, I'm going to put her on a walking, jogging program. No, Tracy can't handle that. Okay. She's obese and she's not currently exercising. So her intensity level should be very, very low. Okay. We're talking about, if we're using the breath test or the talk test, we're talking about saying 3 or 4 words, then taking a breath, 3 or 4 words, then taking a breath, right? We're talking low intensity on heart rate reserve, right? We're talking low metabolic equivalent of a task, a 4 to 5 MET level, right? Tracy is not able to handle anything with jogging, anything with running, nothing like that at this point. She wants to walk the 5K with her daughter that's in a few months. That's a great goal. And we're going to help. We're going to do our best to get you there. Okay. So recommendations for warm up. Great warm up for her is anything that's low impact. Okay. If you know her knees are bothered by arthritis and she carries around a lot of extra weight, so helping to try to get some of that weight off while slowly progressing her body to be able to handle the intensity of exercise is important. Okay, so examples, someone gave an example, did an awesome job, recommended water walking. Awesome. Let's use a low impact, It is weight bearing. However, we're in the water, so it makes it non weight bearing almost. It's a low impact exercise for her. Water walking, great idea. Having her use the elliptical for 5 minutes to help get warmed up. Awesome. Riding the bike, 5 minutes. Great. Walking, light walking, 5 minutes. Awesome. Okay. Just doing a dynamic type warm up with leg swings, few body weight squats, arm swings, marching in place, low impact jumping jacks. So they're modified. So she's just doing steps. Any of those. Awesome. Okay. Great start for Tracy. Some of you said you would have her do a warm up for 10 to 15 minutes. Tracy can't exercise. Her warm up should not be almost as long as her exercise routine. Okay. You're going to start her in the FIT principle. You're going to start her trying to get her in 30 minutes. Okay. Having her do 1 to 2 days of resistance training. Also great. Okay. So Tracy's frequency should look like 3, maybe 4 days to start. And low impact exercises. She's going to be walking for her 5K. So we want to train her in a way that is going to be similar to what she's training for. So if you're having her exercise 3 days a week, then 2 of those days can be walking. Awesome. Okay. And maybe one is low impact with water walking, or maybe she's biking instead, or doing the elliptical for 10 minutes and then doing her biking for the last 10 minutes. And then you're working on resistance training, right? Resistance training, many of you recommended that she only do lower body resistance training. She's a beginner. We want her to do a total body workout. Okay. So chest press, lat pull downs, absolutely, she can do some squats. They're probably going to be body weight squats or some light leg press. That would be a great option. Body weight squats, leg press, some bicep curls, and maybe some type of core exercise or glute exercise. A lot of you recommended the glute bridges. That would be fine. But really getting Tracy moving is going to be important. We know those that move more with arthritis, it's less, it helps with their arthritis as well, right? So that's going to be super important, getting her moving. If you didn't give me some type of exact progression for her, you also probably lost points for that. Your ACSM textbook, the smaller one that's recommended, it's in there, but it's also in your regular textbook. Says a proper progression for a individual that is new to exercise or a beginner can be somewhere between 5 to 10 minutes every week for the first 4 to 6 weeks. I kind of go off the 10% increase every week. So if you're having Tracy exercise 30 minutes, 3 days a week, okay, 10% increase, so 30, 60, 90 minutes total that week. 10% increase would be 9 minutes. So round it up to 10, right? For week 2. Okay, so maybe you add 5 minutes on Monday and Friday for her exercise. And then Wednesdays stay the same. Week 3, we're at 100 minutes of exercise. So a 10% increase, we're going up to 110 minutes. Okay. So gradual progression, right? Resistance training, 8 to 12 repetitions, probably 2 sets, maybe 1 set even to start and 2 sets ideally, getting her there by the second week, right? 8 to 12 reps. We are dealing with an individual who is, again, sedentary and obese, okay? She's not regularly exercising right now. That is the biggest impact. If she came to you and said, oh, I walk 3 miles a day on Mondays and Fridays with my friend next door, it takes us an hour and 20 minutes, but we walk 3 miles. It's different, right? Than an individual who just tells you, I exercise once a week, and we're not even exactly sure what that 1 day a week of exercise looks like, okay? So we want to be careful of her joints. We want to be careful of her asthma, right? And she's a beginner. So starting slow and giving her those little wins, right? A little win of, oh my gosh, I made it through my 30-minute workout today. Tracy's going to be so happy, right? Giving her the little wins, the little goals to help her be successful. Other question that was asked was what 2 physiological changes, or give 2 physiological changes that you think can, like, that will happen when Tracy starts exercising. Your ACSM, obviously your textbook says this, but also page 11 of the smaller ACSM guides has a ton. I think every single one of you said the same too, which again tells me AI told you the exact same too. Stop using AI. Reduction in cardiovascular disease, that would have been a great one to say. Improvement in arthritis factors, improvement in cardiovascular health, decreased chance of getting diabetes, which she had a family history of, and especially she's obese. She's 46. This is prime age for her to be getting diagnosed with diabetes. Okay. So again, please just use your textbook. Your textbook has a ton of resources for you. And if you're unsure, I'm one email away, guys. I'm more than happy to help. I want you to be successful in this course, and I want you to get a lot out of this course so that when you go and work with your own clients, whether it is going to be personal training, whether it's going to be physical therapy, whether it's athletic training, any of this stuff, it is transferable across all boards. Okay. So I want you to be super successful when you're working with your clients too. If you have any questions, let me know, and I will talk to you all soon.